And we're live here at the annual fall seminar at Burton Manor in Livonia. We've got everyone just starting to file in. Dr. Nemeth is giving his first presentation at 9. So in about 10 minutes, Dr. Nemeth is going to be presenting, and so will Dr. Katranji. And then afterwards, Dr. Gordon Christensen is our guest speaker. We've got lots of vendors here today, showcasing their different products. Everyone's just starting to file in here at Burton Manor. We've got breakfast. We're going to be serving lunch. We've got all of our YouTube videos streaming here on a screen right in the middle of the table. And everyone's just getting their coffee and their juice in to caffeinate themselves before today's seminar. We do this every year in Michigan for 6 continuing education credits. And today we are having a Halloween-themed seminar. And we've got muffins. So I'd like to show you guys some of the vendors that we have here. How you doing, guys? Hey, we're live on Instagram or on YouTube right now. So if you want to give a little pitch about what you guys got over here, now's the time. Yeah.
Dental Corporation specializes in photography. The only camera's ever been made just for dentistry.
Really?
The beautiful composite line is the only composite relief, first composite to recharge, release fluoride, and 5 other ions. We would like for restoration. Finishing polishing made simple and efficiently through our Super Sand disc system into one class finishing polish.
That's awesome. Very nice. What's your name? I'm Skylar. Nice to meet you. Yeah, thanks. How you doing, sir? I'm great. How are you? Good. I'm Skylar, by the way. Nice to meet you. Yeah. Hey, I'm Skylar. Nice to meet you. We're live on YouTube right now, just so you guys know. Showcasing a little bit of what everyone's got going on over here.
My name is Emil. This is Jerry. We're with Lake Michigan Credit Union. We're here at this continuing education event for dentists and dental hygienists. We're here to talk about our dentist/doctor zero-down mortgage. It's an excellent way to pay off your student loan. Student loans buy a house with zero down. We also have our community X program, which is for educators, first responders, medical staff, dental hygienists,
Exactly.
as well as military and government. So we're just here to spread the word.
We're proud to be financing a lot of these doctors to begin with.
That's fantastic.
It's been really nice. We've seen a lot of our past clients out there.
That's fantastic. Yeah, I remember actually doing some research about you guys. I was the one that set up the presentation that's going to be running during lunch and everything. So,
We finance a lot of these doctors and a lot
it's
of
got to
these
come from somewhere. Fantastic. Yeah, well, it was a pleasure meeting you guys. Yeah, take care. I'll be around. I'm going to do more laps. All right. They were very nice gentlemen. And hello. This looks like Sunstar, who does all of the floss picks that you can see in some of our other informational videos. All right, let's see who else we have here. Got some of our beautiful before and after cases being showcased right in the middle here. We got bagels, we got fruits. This is Nobel, who we do a lot of use for our dental implants. How you guys doing? I'm Skylar. Nice to meet you. I'm doing a little live stream on Instagram on YouTube, so if you guys want to give a little pitch, now's the time. So you guys do a lot of the dental implants. I know Dr. Nemeth and Dr. Katranji use Nobel for, yeah. So,
King of innovation.
very nice. So are these what you use to actually screw in the implants, or?
Yeah, so this is a rendition of a temporary abutment.
Okay,
It's just showcasing our 10-step abutment that's missing the release.
very nice.
Yeah.
That looks fantastic. Oh, so it's just a larger scale of what the...
Larger scale.
I see, okay. So you can get a visualization.
Yeah. Otherwise, these are implants.
Oh, they're so tiny. Yeah, exactly. Very nice.
We got our newest trefoil right here for wash concept.
Mm-hmm. Very nice. Looks really good, you guys. I like the setup over here. It was nice meeting you. And we've got more implants over here. I am interested in seeing what this whole... What's up, Dr. K? Hey. I'm streaming live on YouTube right now. Good to see you guys. These are two of the doctors that work in our office. I know you guys have seen Dr. Katranji before and Dr. George. The famous Dr. George, the one, the only. I think Dr. Nemeth actually mentions that case that you guys did together in the presentation today. So I'm going to cover that whole thing live. So yeah, they'll be able to see it. It's good seeing you guys. I want to know what this glorified hair dryer is right here.
What we do is we actually kill airborne viruses in the dental practice.
Oh, I see.
By
It's an air
aerosols.
purifier.
Yeah, by aerosols from odors, gases, VOCs. This actually comes out. This is what the machine will take out of the dental air every 30 days.
Oh, wow. Holy cow, that's all that would be in the air.
That's particulates. So when you think about sick days in the dental office,
Yeah.
just to overall health.
Wow.
I mean, the U.S. Department of Labor did a study in 2015, and dentistry is the most hazardous job to your health in America.
Really?
Yeah.
The most hazardous.
Exposure to disease, infection,
Oh,
radiation.
because of all the chemicals that are in the air.
Yeah.
Wow.
So you got a commercial space, patients coming and going. You got the Stavry Center. Put that all together, it's toxic soup. I mean,
Wow.
you put a handpiece in a patient's mouth, they're airborne for 41 hours
Wow.
per patient.
That
So
is
the cloud of aerosols fills the office.
that's insane.
Yeah.
Wow. Well, that's fantastic. Surgically clean air, that's the name?
Yeah.
Wow, that's great. I'm Skylar, by the way. Nice to meet you. Yeah, take care. Right, we got Doran Mayhew over here. Solution Reach in the back. Everyone's just starting to file into the main seminar room over here. We're doing good. We got Don here who works in our office. He's another one of our marketing friends and associates. And over here we've got some cosmetic dentistry, I'm assuming, right? Yes. I'm Skylar, by the way. Nice to meet you. Yeah. I work with Dr. Nemeth. I'm streaming live on YouTube right now. Yeah. Aligners. I see. So it's almost like a version of ortho in a way? Okay. Oh, very nice. Looks great. It's a pleasure meeting you. And everyone is slowly, look at the man of the hour, Dr. Nemeth, getting all the attention right now. Sorry. It is packed in here today. Here at Burton Manor in Livonia. Our speaker today is Dr. Gordon Christensen. He should be starting to speak in a little over an hour. And Dr. Nemeth is greeting all of the attendees at the moment. Everyone's just starting to file in, so I might run and get a few more of the vendors so you guys can see some of the awesome products that they're showcasing here today. That air filter is really cool. Should talk to Dr. Nemeth about getting that at the office if we don't have it already. Wow, check out that jack-o'-lantern. That is something right there. How you doing? I'm good. I'm streaming live on Dr. Nemeth's YouTube channel right now. Skylar. Nice to meet you.
Fantastic.
Tell me a little bit about what you guys do.
So we're a lab in Sterling Heights, and we're going all digital. So everything we do is scanned, whether we get a conventional impression
Very nice.
or whether we get a digital scan.
Is that the name of your company, Scenic America?
Martinez Dental Lab. And then these are all milled, so this is wax up, so we don't do any hand waxing anymore. So everything is milled.
We did a fun.
Oh, it's like a brass knuckle.
It's like a brass knuckle, only it's
Him molded.
He looks like he took a shot already in the side of the head. That's fantastic.
and then all this stuff is 3D printed, just like the
It's 3D
just like the
printed.
brass knuckle. So you
Very
can see
nice.
the fine detail
Yeah,
of this stuff. This is all comes
Wow.
out of the printer.
That's
But of course,
fantastic.
printing models for dental is the key, and these have stop rods built in for centric occlusion.
That's fantastic. It looks so precise.
It is.
Yeah, very nice.
amazing.
Awesome.
It's the best precision.
It's a pleasure meeting you. Yeah,
30 years. So.
awesome. Take care, you guys.
Thanks, Grantler.
Of course. How you doing?
Good. How are you?
Good. So tell me a little bit about what you guys do.
Well, we are healthcare financing. So basically, anybody that has an out-of-pocket for treatment, they can get credit just to pay their full payments.
Fantastic. What's the name of your company? Care Credit? Very nice. Nice meeting you. Yeah. Have a good one.
Thank you.
We got more over here. All kinds of products over here. These look like retainers of some sort, which is awesome. This looks like turning your office into a smartphone, so everything controlled in one place, which sounds great. Still got lots of people filing in here. Let's see what we got going on out here. I know we got a lot more of our staff in this entry room over here. So let's see what's going on in the entry room. I know we got more vendors over here. How you doing, sir? I'm doing well. I'm streaming live on Dr. Nemeth's YouTube channel right now. Great. Yeah, what do you want to tell me what to do? The scrap? Oh, that's fantastic. That's amazing. Fantastic. I'm Skylar, by the way. Yeah, nice to meet you too. Enjoy your day. Very nice setup you got over here. I'm Skylar, by the way. Nice to meet you. I'm streaming live on Dr. Nemeth's YouTube channel right now. You want to tell me a little bit about what you guys do?
So we have Golden Dent, specialize in physics forceps, which are our extraction instruments over here. We do have a line of separators and needle holders, crown removal instruments, and we have an implant locator, a penguin for measuring ISQ technology.
Very nice.
Our ND guide for implant split casing, and our dent and grinder.
I love your guys' setup. It looks beautiful over here.
Thank you.
All the equipment looks great. And how you got all the little videos set up, that's fantastic. Talking to the video guy, I love the setup. It's fantastic. Yeah, it's a pleasure meeting you. I'll be back around. Awesome. And we have our amazing Dr. Nemeth's team over here. The gals checking everybody in, wave hi. And Olivia, what's up? And we got Tara and Colleen checking people in. Cheryl, good to see you, Cheryl. Hey, we're live on YouTube right now. Say hello. Hey. Awesome Dr. Nemeth staff over here. These are the ladies that make it all happen over here. And I think it's time for us to go into the main room. Walking through Burton Manor. Say hello to our friends over here. Everyone's just about ready to get started. It is 9:05, so Dr. Nemeth should be going on at any moment. Uh-oh, I hear the music.
Go way, way back. Emily used to
really change the patient experience.
It's about time. Okay. All right. I'll take care of it. Okay. I will. I'll do it for you. Oh, wow, it looks like they're getting everything set up over here. Oh, and I'm getting blocked. Yeah, they're just kind of creating a...
Can you guys hear me? This is supposed to be a
Oh, I see.
handheld mic. As far as I know, a handheld mic means I can put it with me. So
Let me sneak in. I know, the gimbals are great. Excuse me.
Just stand right here. Hi, I'm Joe Nemeth, and welcome to today's seminar. I think you're going to enjoy it very much. This is my colleague, Amar Petranchi, and we want to really welcome you to today's seminar. It's going to be great, and I'm being taught what to do with this microphone. So this is terrific. Before we begin, I want to acknowledge our FALS and our co-sponsors, Professional Endodontics, and here is Dr. Steve Shah, who's going to talk to you a little bit more, and they have some things to show you. So welcome, glad you're here, you're going to love it, and we're going to love talking to you, and especially it's going to be totally great, as usual.
Thank you, Joe. First of all, we want to thank you for giving us the opportunity to be part of this great event. Not only do we learn a lot, but we have a lot of fun doing it. So. I want to introduce my partners at Professional Endodontics, Dr. Lou Shawha, Dr. Jeff Martirosian, Dr. Eric Richardson. Unfortunately, three of our endodontists, Dr. Gabrielle Nori, Dr. Andrew Shelf, and Vajra Metro could not be here with us today because somebody had to work, so they got short straws, so they're still at the office. If you get a chance, come and say hello to us back at our booth there. If you get in or out raffle, just want to leave me your email address. We've got some great prizes you can see there. I'd like to introduce my partner, Eric Richardson. He's going to show you a few interesting cases that we've treated at Professional Endodontics utilizing our cone.
Professional Endodontics is on right now, and they are our co-sponsor for today's seminar. They are an endodontic office here in Michigan as well. Morning.
So like Steve said, my name is Eric Christensen. I appreciate the opportunity to introduce myself. I'm just going to say a few words about the practice and just a real brief presentation today about CBCT imaging and endodontics, something that's become a little more relevant in our field in the recent years. A little about myself. I grew up in Beaverton, Michigan, just a few hours north from here. Did my undergrad at the University of Pennsylvania, did my dental at Michigan, and my endo training at Marquette University in Milwaukee. Made my way back to Detroit area in 2010, joined Professional Endodontics. You can see the docs pictured here. I know Steve kind of went through and introduced everybody already. We do have 3 offices, one in Southfield at 12 and Telegraph, another in Clinton Township at 19 Mile at the Henry Ford Complex, and the third one in St. Clair Shores at 10 in Little Neck. And in professional endodontics, we really do pride ourselves on providing very high caliber endodontic care. We utilize the latest in technology, and we really make every effort to create a comforting environment for your patients.
Everyone's still filling in. These are my guys right here, video guys. What's up, bro? All the men making that magic happen back here.
What I'm hoping to do is just go through some basic advantages, maybe some pitfalls, and then finish with some fun cases. So when I was coming up with the title for today's lecture, it came from endodontic vision. And I like the word vision because it really has a dual meaning. Meaning you can either vision
And
with your
everyone
eyes,
has their booth, so it's only right that we have our booth set up over here. This is our awesome Dr. Nemeth and Dr. Katranji booth set up over here. Wave hi, Peggy. You're live on YouTube right now. We have a little dry ice jack-o'-lantern over here that I think we ran out of dry ice, right? We had it running for too long this morning. Halloween themed. The vein finder, we use this to find veins in all of our patients if they're difficult to find. And we've got little goodie bags over here, pens and all of our materials, and a beautiful rotating thing, which was Peggy's idea. I'll give you credit for that one. It turned out looking great. Oh yeah. The pinhole technique, everything you need to know. Dr. Nemeth's beautiful face right here with Dr. K. They're both going to give presentations here in a minute, so I want to keep you guys posted so that you guys can see that. Unfortunately, I'm not going to be streaming the entire seminar today because Dr. Gordon Christensen is about to be lecturing for maybe 4 or 5 hours. Oh yeah, why don't you show us how the vein finder works? Maybe on my hand? Okay. Oh, wow. All right. Yeah, we've had a good amount of viewers so far. Almost. There we go. And we're back. Sorry about that, guys. Internet connection. You know how technology is sometimes. Never works when you need it to, right? Thanks, Peggy. And we have Professional Endo who is speaking right now. I'm Skylar. I work with Dr. Nemeth. I'm streaming live on his YouTube channel right now. This is Professional Endo. Okay. One in Southfield. So if you're in Michigan and you're in Southfield, Clinton Township, or St. Clair Shores, Professional Endo is awesome, and they are with us at the seminar today. Of course. Whole booth over here.
Another one, textual fracture. Tooth number 30, patient has body discomfort.
Looks like they're giving examples of some of their cases here. I don't know if you can see that, but packed house today for the fall seminar.
Radiolucency corresponding to the end of that post. We isolate the root a little further. We have small little fractures that correspond to the lesion. And unfortunately, again, this tooth requires extraction to get the location of the fracture. But again, we report it through unnecessary work. Section root defects, tooth number 7. Patient came in, see a couple different radiolucencies. We want to know if it's a little more internal, external resorption. You see from the CT images, everything stays contained within the tooth. It's a little better. Treat the tooth, get a nice result.
Showing some of his cases now.
29. We got a decent sized radiolucency. She indicates that she's having some altered sensation to her lip. So a little concerned about the metal frame. Take this right through the metal frame and add that over the apex. From the other images, we can see that bundle is going to travel just equal to the end of the root. So to minimize risk or trauma to that nerve bundle, we're going to just get true measurements, treat the tooth to that length, minimize any trauma to that nerve trauma. She's also lived this case come back just fine. Diagnosis of traumatic injuries. So we patient came in number 22. We see something's off with this case. So we took a CT and he's fractured the mandible. Told mom he was breaking up a fight. So in this situation, we can see the fractures. He's referred Beaumont to reduce those fractures and to follow up with any endodontic needs from there. So things are not always as they appear. And CT images are fantastic in assisting us in developing a treatment plan. But I do caution they're just one piece of the puzzle, right? A thorough clinical exam, discussion with the patient, discussion with the general dentist is always important to maybe develop an appropriate treatment plan to that specific patient. In these next cases I do not have a CT on, they were kind of when it take place, but they show a substantial amount of bone loss, maybe more indicative of a root fracture. And I can imagine if we did take a CT in these cases, it would look pretty terrible. Now, with the discussion with the patient, we access the teeth, no fracture can be identified, we seal them up, and we get excellent healing. So again, this patient, moving forward, we can still retain this tooth. Another case, it's number 31, retreat the tooth. A substantial fur prepared for bone loss, pretty much good for healing. Another case, this patient, number 19, came in deep probing depths. Complete fur bone loss, indicative of maybe a root fracture. You can see on the recall, the healing, all the anastomosis and connections. Another one, an elderly patient trying to retain the bridge. You can see almost complete bone loss on that distal root. You can imagine if I took CT, it would be very indicative of a root fracture. To retain the bridge, we push forward, and she's healing fantastic. One more case here, a younger patient, large lesions, same thing. We're trying to retain the tooth as long as possible. We get excellent healing. So lastly, why endodontics is exciting to us as an endodontist. These are some of the cases that we see from time to time, kind of some fun ones, so the complexity of the root canal system. This tooth number 30, I retreated it, we had it with the 6 canal or more, so we get a recall, fantastic. Another one was number 18, you can see the curvature on the stern portal, did some lateral canals, keeps our day interesting. You see this time and time again with ghost roots, right? The roots you never expected, lower more upper molars. Another good reason we take CT to this family, to identify so we look at this one, number 3. We've got 1, 2, 3 canals we start with. Now what we're done.
Many of you who maybe have been to our office know the legendary Dr. Nemeth. He is a character and one of the men that does all of our photos and our sutures. And we've actually had lots of comments about how amazing you are and how kind you are and you take great photos. Why don't you say hello to everyone on YouTube?
Somebody's premise.
Where's it going? It's a stabilizer.
Huh?
It's a stabilizer.
Yeah, you see that. Is the camera in your handle?
The camera's on my phone. I just attached the phone. Yeah. And it stabilizes it so it's not shaky. I think Dr. Nemeth is supposed to go back up there.
Totally ignored.
What is it?
These are ignored.
Oh, they are ignored. Is this? Oh, I see what you're saying.
Because they're only facing one way.
Just a second. Here comes the man, the myth, the legend, Dr. Nemeth.
I think I got the trick. Okay. You probably noticed some of our slides here this morning, and I have some cases that I'd like to go over. I have 2 passions in my practice. One passion is getting patients healthy, getting their mouths healthy. Why? Because if you've got gum disease, if you've got periodontal disease, it's going to affect your whole body. We're finding more and more systemic diseases related to periodontal disease. Now, Alzheimer's is the latest, so if you've got periodontal disease or your patients have periodontal disease, it's going to be affecting their whole body, general health. Some studies have shown that they need to take up to 7 years off of their normal life expectancy. So, maybe more importantly than their mouth or their teeth, make sure their gums and their mouth are healthy for their body and any systemic problems. And the other passion I have, besides getting a mouth healthy, is getting a mouth beautiful and comfortable. So I do a lot of recession cases, and here are some of the recession cases that I've done recently. So let's see where we can get going here. Apparently we can't get anything going there. Anyway, I use mainly the pinhole gum rejuvenation technique, or the pinhole technique. I almost never take tissue from the palate anymore. In cases that I thought were impossible to do without taking tissue from the palate, I no longer take tissue from the palate. 1 in 100 cases, maybe I take palate tissue. It's not necessary. You don't need to do it. In the old technique, generally, flaps are laid, sutures are put in, frequently tissues taken out of the palate. That can be a very painful, unpleasant experience for me. I've seen patients who experience that, and I just don't like to do it, and it's not necessary. So this was an interesting case. This patient had had a connective tissue graft on the lingual of the lower incisor. You can see the recession there. And then he went to another periodontist and had another connective tissue graft. So this patient has had 2 connective tissue grafts on the lingual of the lower incisor. Now, that's one of the most difficult areas to get coverage in. The tissue is not very flexible, it's not very easily movable, but it was a challenge to me. So, using the modified pinhole technique, we were able to achieve a degree of success that couldn't be achieved with 2 attempts at connective tissue grafts. And it was extremely gratifying. It was a really good result, and the patient was very happy, and as I was very happy. Here's another case. This patient flew in from South Korea. She was an American citizen, but living in Korea. She flew in. She felt that she had gum recession from bruxism. Well, sure, bruxism was part of it, but her tissue was thin. She had had orthodontic treatment. I would say 70 to 80% of my patients have had orthodontic treatment. Orthodontic treatment, although necessary, very frequently contributes to gingival or gum recession. She flew in from Korea. We did the pinhole technique throughout her whole mouth. Let's see if we can get this going here. This is what it looked like about 2.5 weeks later. The tissue is still a little bit red and inflamed because it's still healing. But we've got great coverage. And if you look at the upper and the lower teeth, the maxillary, mandibular teeth, you look around the cuspids.
There's Dr. Gordon Christensen. He's our speaker for today. This man right here. He's our main speaker that's going to be giving about a 4-hour lecture after Dr. Nemeth speaks right now. After Dr. Nemeth is done, we've got Dr. Katranji over here. He's up next.
About 2.5 weeks later. And I've heard from her since. Everything is going great. Here's another case. This patient was just in recently. These photographs were taken about 4 or 5 days ago. Patient came in with very severe lower anterior recession. Now, this patient had had braces on, had orthodontics and appliances on for a period of 5 years, finally taken off at age 18. Prior to age 18, he had had no recession. Starting at age 18, he started to notice.
He's talking about the gum recession, which may not be obvious to people who aren't in dentistry. But gum recession, you see that area where the gums are kind of going really low. That's what he's talking about.
We saw him, and again, and the lower anterior is probably the most difficult area in the mouth to get coverage on. Probably don't realize it if you don't try to.
He's talking about repairing that area right there.
It's very difficult because of the muscle pull.
See the before and the after.
But here's the after. And you can see we've got great coverage. Patient's very happy. It's still in the healing phase, but this is going to work out very, very well. And we love these cases. These are challenging cases. The more challenging the case, the more interesting, the more fun it is to do. So let's go on to the next case. This patient came in and her tissue was very thin and she had recession, some recession over the implants in the maxillary arch. She wanted to have a good looking mouth, and in order to do that, we had to thicken the tissue, try to bring it down as much as we could. This is what she looked like when she came in. You can see the tissue, the photograph on the left is when we initially saw her. We did connective tissue grafting in the mandible. You can see that thicker tissue in the mandibular arch. In the maxilla, even over the implants, we did the pinhole. We didn't do the upper right. That didn't really need much. But we did the anterior over the implants, and we did the upper left side in preparation for restoration. So we worked with Dr. George, who's a very fine prosthodontist, and together with Dr. George, we were able to give her the results she was looking for. So this is the before, this is the after. You saw the before. Let's see if we have a photograph of the tooth. Okay, so on your left, you can see the before. This is the after. These are cases where people would never normally use, they would always use tissue from the palate. Lower anterior, those lower anterior cases, over implants, I even thought they were impossible to do without tissue from the palate. I never use tissue from the palate anymore. Almost never. It's just not needed. It's painful. You can't get as much tissue as you want. So for me, the pinhole technique is great. I've been doing it for 4 to 5 years, more and more cases, and it's just a wonderful approach to helping patients. That's me with Dr. Chow, and my gold standard for treating recession now is the pinhole technique. So if you have patients who need help getting them out healthy or covering recession, we also do tunnel lengthening. We're happy to help you. And with that, I'd like to have my colleague, Omar, talk about some of his remarkable cases, because there's no one better in the state of Michigan when it comes to building bone and doing implants. I have 2 of his implants in my mouth. I've never even known they were there. It's just like my own teeth. He's the best. He's the greatest. Omar, the stage is all yours.
Thank you very much. I always say this, and I always feel it's true. Nobody can say it's better than Dr. Nemeth. Nobody can do a better job with aesthetics than Dr. Nemeth. When he's talking about the mandibular anterior cases, it's really true. He's done with these cases. It's almost like they were 20 years earlier. So he does a fantastic job. He's an artist with soft tissue. I'm just going to show a few cases. I know it's been kind of a long morning already, so I'll try to go through these relatively quickly. Some of the things that we see a lot nowadays is fractured teeth in the anterior. And a lot of people, they don't want to be in a flipper or an Essex appliance for too long. So what we try to do is we try to get them to immediately fix. In some situations, we're able to do it with their patient's own tooth. In many cases, we also have to order a secondary tooth from the lab. So here's a case, high smile line. One of the things that we're looking for here is, do we have enough bone? In her case, we did have enough bone because she had a very short root. So when we take these teeth out, we try to be as atraumatic as possible, saving the soft tissue, saving the bone. When we place the implant position is critical to maintaining the biology of both the soft and the hard tissue. So in a case like this, I'm able to use her tooth and use the tooth as a temporary that's immediately loaded and attached to the implant. So the patient walks out almost like they did when they walked in. I'm taking very careful detail with the position of the tooth. I don't want the patient to brux or hit this tooth during parafunctional activity. And I also don't want this to create any sort of openings for plaque and bacteria. So we really want to make it a really tight contact with the soft tissue. And you can look, this is a screw routine. We're able to hide the occlusion. And when the patient comes back, the soft tissue is maintained. So we see a lot of those cases.
I'm so fortunate to be able to work with doctors who are great speakers and just very talented at what they do.
Like a history of oral disease, and then of course if Dr. Nemeth can't save the teeth and they're in my chair, at that point we have to move forward.
Oh my gosh. Take a look at his socks over there.
In this case,
He's got the legendary Dr. Nemeth socks on right there.
This was the older technique on the lower. On the upper, we decided to use a guided technique. And what that requires is quite a bit of workup beforehand. We're able to position the implants exactly where we wanted to before during planning. We're also guiding the prosthetics, so the prosthetics are going exactly where we want the teeth. And within a few hours, this used to take 5, 6, 7 hours, Within a few hours, sometimes 2 or 3 hours, the patient is in and out of the chair, and we're finished with a full arch of front teeth. And 3 to 4 months later, the patient comes back and then is ready for final restoration.
He's talking about all on 4 right now, which is 4 implants that you put in your mouth that basically support a brand new set of teeth.
In some cases, people come in and they don't have any bone for that type of treatment. So they'll come in specifically for the all-on-4, they'll come in for a guided case, but they just don't have enough bone. This is a case I recently uncovered. I just wanted to show how we deal with these cases with a little bit of radiographic evidence of bone regeneration. So here we have very little bone. There's no way I can place implants and load them the same day, and the patient's aware of this. Beforehand. We do a bone graft where we take the patient's
that material right there is
bone, and then cover it up for about 6 months.
He's talking about that bone graft.
Here's an X-ray of before and
We're
after.
taking material from the palate. I'm sorry, platelet-rich plasma to make bone regeneration.
So now we've created a space that can accept an implant. And then kind of a transition, if you look at the red arrows, you can start to see the bone fill in from one CT scan to the next. So we're able to transition these patients from being kind of a dental cripple to somebody who can actually regenerate and give them a final prosthesis. So those are my cases. I know I went through them quickly, trying to get us back on time here. I do want to go over one more announcement. There is an orange card that you have. If you want to get credit for your CD and you have an AGD number, this has to be filled out and turned in. So if you take some, a minute or two to just fill out, and then turn that in, that way you can get credit for the season. I'm going to turn it back over to Dr. Nemeth. Thank you very much, and we're going to have a great program today.
Yeah, that orange card is actually quite important, not only for AGD,
Nailed it.
but just to verify that you've been here. So make sure that you fill it out, put it, leave it here. We can also have information so we can give you further announcements on further meetings or educational information that may be coming up. By the way, if you have not worked with Amar on an implant case or a bone regeneration case, I urge you to do so. You will have the most pleasant, enjoyable experience, at least as pleasant and enjoyable as it can possibly be, as far as working with a periodontist with implants. He's really, really amazing. I also want to mention our spring seminar.
Our speaker
is
Dr. Gordon Christensen right here. He's about to go on next.
Thursday, April 25th. It's at a new location. It's at the Troy Marriott Hotel in Troy, obviously. Our guest speaker will be Dr. Tom Rams. Now, Tom, I know, he's an amazing guy. He's professor of periodontology and oral implantology at Temple University School of Dentistry and professor of microbiology and immunology also at Temple University School of Medicine in Philadelphia. Dr. Rams is also director of the Oral Microbiology Testing Service Laboratory in Philadelphia. Now, I'm treating many, many perio cases with a laser and microbiological testing. The results are just absolutely gratifying. His topic will be the role of microbiologic testing and LANAP laser therapy in periodontics. You don't want to miss it, and you might want to mark that date down. Again, it's Thursday, April 25th at the Troy Marriott. In honor of Breast Cancer Month, we will make a donation to the Shades of Pink Foundation on behalf of every person in attendance today. So, just want you to know that your presence here is also going to a really good cause. Our speaker today is a legend in dental speaking and needs little introduction. Truly, you've all heard of him. I mean, he's not only nationally known, he's internationally known. He's amazing, and I will say one other thing, he is amazing. I hate him because he's actually a little older than I am, and he is as vital as any human being can possibly be. He's a practicing prosthodontist in Provo, Utah, and is the founder and CEO of Practical Clinical Courses and the co-founder of Clinicians Report. Please join me in welcoming Dr. Gordon Christian. You will learn a lot.
Nobody's older than I am.
That's the problem. That's the problem. Thank you.
Okay.
Let me get this stuff out of here.
Good. And I'll get myself plugged in. You've already had a reason for being here today. Unbelievable kinds of things are going on, aren't they? I have always practiced that I practiced with for many years.
Nice job.
Someone that anyone in Perio knows, Robert Shalhorn. Shalhorn was a god in Perio. One of the first ones to take the iliac bone crest and stick it in the mouth, move your butt to your mouth. It's a little bit hard, but he did. So I have great respect for those who are still pioneers.
So, Dr. Nemeth did a great job. Dr. Katranji wrapped it up nicely. Dr. Nemeth is coming back to his booth over here, sit on his throne. I want to thank you guys so much for tuning in and watching. We do this every year. We also do it in the spring, as Dr. Nemeth listed. If you're interested in getting some dental CE credits, you live in Michigan, you want to travel to Michigan, check out our channel. Feel free to comment or reach out to us. And I just want to say thanks again for watching. Have a good day, you guys.